dental infection, we struggle to get the patient numb. And we've always struggled to get the patient numb. And there's a reason for that. When you have infection, the tissue in that area has a pH as low as 5. And pH is a logarithmic scale. And so if you put the anesthetic in at 3.5, the highest it can go, because the tissue has to buffer it, the highest it can go is 5. And at that, because it's a logarithmic scale, there's no available base form of the drug, which is what's necessary to get the patient numb. So what we've done in the past is that we give patients antibiotics and we send them home. We have them come back 3 or 4 days later. And antibiotics in dentistry do not solve the problem like in medicine. All it's doing is knocking the infection down, allowing the tissue to come back to a higher pH so that when you give anesthetic now, maybe it will work. And you can do the procedures that's necessary to get them out of distress. If you have buffered anesthetic and the tissue is still at 5.0, so it's still infected, and you put the anesthetic in at physiologic pH, now you have a much better chance of getting the patient numb so you can take care of the procedure right away, and there's no need for antibiotics at all. And what we know is the more often we prescribe antibiotics, the more opportunity is for the bacteria to become resistant to that antibiotic. So the less antibiotics we use in medicine and dentistry, the better it is for the overall population and certainly for the patient that you're working on.